A very good afternoon to one and all. Today I will present a paper on the effect of low-dose atropine on choroidal thickness in children with myopia progression. I have no financial interest to disclose. So this was a prospective case control study which was done in the Department of Ophthalmology, KIMS Bhubaneswar, to determine the effect of low-dose atropine on choroidal thickness in children with myopia progression and to compare the rate of myopia progression in cases versus controls in terms of the changes in spherical equivalence, axial length, best corrected visual acuity, and choroidal thickness at presentation and subsequent follow-ups. So we took 55 cases and 55 controls aged 5 to 16 years with bilateral progressive myopia, out of which 44 cases and 43 controls were included, and the rest participants were excluded as per these exclusion criteria. So in the 87 children were randomly assigned into two groups, in which 44 children in group A received once daily dosing of 0.01% atropine at bedtime, while 43 children in group B received once daily dosing of a placebo eye drop at bedtime. And the minimum duration of follow-up was 6 months. Statistical analysis was done and a p-value of less than 0.05 was considered to be significant. Now coming to the results, the demographic parameters were comparable in both cases as well as the controls. Now coming to the spherical equivalence, the cases showed a decrease in the spherical equivalence from presentation to at 3 and 6 months of follow-ups, which was statistically significant, whereas the controls showed an increase in the spherical equivalence from presentation to 3 and 6 months of follow-up. Similarly, in the axial length parameters, the cases showed a decrease in the axial length from presentation to 3 months and 6 months of follow-ups, whereas the controls showed a statistically significant increase in the axial length at 3 as well as 6 months of follow-ups. Coming to the subfoveal choroidal thickness, we also found that there was a significant increase in the subfoveal choroidal thickness from presentation to 3 and 6 months of follow-up in the cases as compared to a significant choroidal thinning in the controls at 3 and 6 months. There was a declining trend of the best corrected visual acuity in the controls at 3 and 6 months follow-up as compared to an improving trend of the best corrected visual acuity in the cases. We tried to correlate the spherical equivalence and axial length with choroidal thickness at 3 and 6 months of follow-up and found a positive correlation between the spherical equivalence and axial length with subfoveal as well as choroidal thickness at all the quadrants in the cases group, whereas in the controls there was a negative correlation, but this was not statistically significant. So now coming to the discussion, let's see what are the outcomes of our study. We found a significant decrease in the spherical equivalence as well as the axial length in the cases group at 3 and 6 months of follow-up, whereas there was a significant increase in the spherical equivalence as the axial length in the controls, which signified that there was a significant myopia progression in the controls as opposed to the retardation of the myopia progression in the cases group. The low-dose atropine significantly increased the subfoveal choroidal thickness as well as choroidal thickness in all quadrants in the cases group at 3 and 6 months of follow-up, whereas there was significant choroidal thinning in the controls group at 3 and 6 months of follow-up. There was also a significant improvement in the best corrected visual acuity in the cases at 3 and 6 months of follow-up as compared to a declining trend of best corrected visual acuity in the controls group. There are various studies which were done by Sander et al. In which they concluded that low-dose atropine inhibits the short-term effect of the hyperopic blur on choroidal thickness, and when it was used alone, it caused a slight thickening of the choroid in the young, healthy myopic eyes. Similar study done by Wu et al. Also found a significant increase in the subfoveal choroidal thickness in the group which was treated with atropine, and they found a significant relationship between the changes in the subfoveal choroidal thickness and central corneal thickness. And these studies were at par with our study, but a study which was contrary to our study were done by Wu et al. In which they found that 1% atropine increased the choroidal thickness, whereas 0.1% at 0.01% atropine caused a decrease in the choroidal thickness after 6 months of treatment. There are various limitations of our study, like less sample size and lesser duration of follow-up, and we didn't take into account the pupil size and accommodation amplitude as well as other risk factors for myopia progression. So to conclude, low-dose atropine is effective in retarding myopia progression in children, and there is a need for further studies with larger sample size and longer duration of follow-up, along with need for studying the rebound in myopia progression after cessation of the drug. Thank you.
What was the normal value of choroidal thickness? I mean, what is the OCT? Which one? What is the instrument that is used to measure the OCT thickness?
So we use the normal SD OCT to measure the choroidal thickness at the subfoveal level as well as at the 1500 microns and 3000 microns in all the quadrants, superior, inferior, and temporal and nasal to the fovea.
Okay. And then another thing is you could have done contralateral study, no, in the other eye. I mean, keeping that as a control.
Yes, sir, we are planning for doing the contralateral study in the other eye.
I
We
think
have
that
just
would have
started the
been
study. Yeah.
better option, no, rather comparing to groups.
Yeah.
But
Yes, sir, we are next planning to do that. We will take atropine in one eye and the other
Yeah,
eye we
yeah.
will put a placebo drop, and we
Yeah,
are on the verge of doing
yeah,
that.
that is, I think, better. Anyway, it's a good study.